Hi, Laine.
How are you?
I'm good. How are you?
Good.
Thanks for taking the time to meet with me today.
Of course. Thank you.
Yeah, of course. So we can just get started. I'd like to start with a brief introduction, if that works.
Of course.
I'm Sophia, the content specialist at Caily. If you'd like to go into who you are and what you do and where you work.
Perfect. So I am Laine Berg. I am a hearing instrument specialist with HearingLife in Greenwood Village. Our clinic at this location opened in August of last year, and we have 12 other locations in Colorado.
Awesome, great. I think we can jump right in then. So today we're going to be discussing a little bit to start of the signs of hearing loss. Would you like to go into what are some of the most common early signs or any signs that are overlooked?
Yeah, the most common early signs are typically the things we've all heard: TV being loud, phone conversation is difficult, music they're listening to is also uncomfortably loud for others, as well as ringing or buzzing in the ear or the tinnitus that can also actually be a sign of hearing loss as well.
And how would someone be able to distinguish between like temporary hearing issues, like wax buildup, or something that everybody experiences with early signs of hearing loss?
There's a few like signs and indicators questions that we ask to be aware of that as well. One of the things being like, is there any pain or discomfort in or around your ears? Is there any wax or discharge coming from the ear? As well as in Colorado, have there's been any elevation changes? Are you sensitive to pollen with allergies, things like that? But that's
Hmm.
also why it's important to do annual hearing screenings so we can monitor and catch red flags or signs that something more concerning or that there's hearing loss developing.
And at what point would you say someone should consider seeing a specialist? You said yearly check-ins, but on top of that.
Yeah, so the slogan is test your ears at 60 years, but even before that, if there's any indicators of family members mentioning signs of loss, you're having
Mhm.
difficulty with conversation, but it's also just as important as like getting your eyes tested that
Yeah.
annual.
For people that want to be preventative about hearing loss, do you have any recommendations?
Yeah, best thing, of course, listen to things at a moderate noise level. But when we are in those situations, wearing hearing protection, but also things like managing your stress level,
Mhm.
diabetes, and things like that also lead to more hearing loss. So just managing things like that for your overall health impact and prevent hearing loss as well.
That's interesting. I don't think I thought of those other things that can affect
Yeah,
hearing loss. It's usually like wear earplugs when you go to a concert, but that's really interesting.
yeah.
How would you recommend talking to a loved one that may be experiencing hearing issues and addressing that with them?
Biggest thing is understanding why that person is opposed, right? So everybody has their reasonings. Is it vanity? I'm too young to need hearing aids. They
Hmm.
also have a stigma, right? They used to be big and clunky and squealy. So I like to just more address it as, let's go in for your overall brain health, and then if we see that you need devices, they aren't what they used to be, let's talk about
Hmm.
it, see what benefit it can bring to that individual. It's a lot about knowing why exactly they're opposed.
Yeah, and framing it as like hearing health is just overall health.
Exactly.
So,
Instead of you need
yeah,
hearing aids, let's go in and find out where we're at. I'll get a screening as well.
yeah,
Let's
exactly.
go in and find out the options before we like throw the devices at them.
Yeah, for sure. And then going off of that, so we're going to pivot into hearing loss and isolation. How does untreated hearing loss contribute to isolation with older individuals, would you say?
So one thing, if you can't hear, you can't really participate, right? So I
Right.
find that a lot. People in group conversation just end up sitting out, nodding along, or deciding to not even go and do their clubs that they used to be a part of, or family activities are hard. Grandkids talk really fast and
Mhm.
excited. It just ends up making it so people are no longer engaged and just step out of those things, which we all know social isolation leads to dementia and so many things.
Yeah.
Not being able to be a part of the conversation, you just naturally start to step aside.
Would you have any like simple tips for anyone that is communicating with someone that has hearing loss that you know of, like whether that be speaking louder or just being slower or anything like that?
Those are two main ones, right? But also, like, even whether If they have a more profound loss, even if they are addressing that with a hearing device, main thing is getting their attention. So saying their name at the beginning of the conversation to make sure you have their focus.
Hmm.
Talk across the room or when there is a lot of background noise. Be mindful. And sometimes it's not just speaking louder and clearer, but rephrase something. If you've said something 3 times the exact same way, how else can we word it to get that same point across? Sometimes that alone can make a huge difference for someone.
Yeah, just taking that like extra care and attention for
Exactly.
sure. And then talking about hearing instruments, how can they help people like reconnect socially? And then quickly do people using them usually see a difference or hear a difference?
Yeah, immediately. So part of their initial assessment, we do the hearing exam, and then we talk about where their loss is at and try on devices immediately. And we
Mm,
do some scenarios in office playing background noise. We like to have a family member or someone close with them as well so they can hear a familiar voice, hear the difference. And once someone gets those devices, I encourage them, what was your favorite restaurant to go to before? Something you like to do, a group activity.
mm,
And I encourage them to do that in the first couple weeks and tell me the differences. They had noticed an immediate difference, and I have people coming in and talking about conversations with grandkids or a club that
mm,
joined her. A lot of times people struggle in church. Church is a very difficult environment, so I hear that a
mhm.
lot from patients as immediate relief, being able to hear in that environment as well.
Wow, I can't imagine how amazing that feels.
Yeah, I really feel like I
Right.
give people a piece of their life back in a
Yeah,
sense. To be able to put those devices on and they immediately like get teary eyed or tell me I heard a cricket in my yard the
right.
first time. Like it's really impactful.
I feel like that's something like very able hearing people probably take advantage a lot. Like me, I'm just thinking about if I couldn't listen to music or something like how I like to do, like that would be affect my life a lot. So that's great that you do that.
Yeah.
Is there any like specific outreach or support programs that you recommend for people dealing with isolation from hearing loss?
There's a couple like that are the nationwide. So the Deaf Community Counseling Services, they have a bunch of support groups that you can join online, as well posting local ones. The Hearing Loss Association of America as well,
Mm,
Facebook groups. But then there's also things like CaptionCall, which provide free phones for people at home that will do live captioning for phone calls so they can connect with their family members or loved ones or friends and just have that live caption as well because phone can be very difficult, so that's
mm.
another great resource for people.
Wow, that's interesting. I didn't even know that existed.
Yeah.
That's great.
There's a few of them out there. Caption Call and CapTel are the main ones in this
Okay.
area as far as I know, but yeah, it's great free service for people with a hearing loss.
Okay, wow. Great. Then just pivoting to more about like hearing and brain health. Are there particular brain functions that are most affected by hearing loss?
The main one is going to be memory, and then as well as word recognition. It's one of those things, unfortunately, if you're not using it, you lose it. So, those pathways in
Hmm.
your brain that are stimulated hearing things, once you start developing a hearing loss, those pathways start to die off. And unfortunately, what we see, we do some word recognition testing, and people can't decipher between the word cat or the word hat, no matter how loud we make that word. And that's a
Hmm.
sign of going untreated for too long. Yeah, that's what we normally see.
And then what is that connection with hearing loss and dementia or Alzheimer's?
So, a mild hearing loss doubles your risk of dementia. Is specifically for that. It's brain strain as well, which also there's a lot of research out there. The more strained your brain is throughout the day, it leads to more cognitive
Hmm.
decline, social isolation as well, because you can't participate in things. So it's
Yeah,
all
wow.
linked hand in hand, unfortunately.
What advice do you give patients about protecting their hearing and cognitive health as they age?
Treat your loss sooner rather than later. Go in annually, but as well as stay active. Try, even when it's difficult, try to join groups or be honest that you might struggle with a hearing loss and have people accommodate you in a seating arrangement. Read out loud to yourself. Just keep that brain stimulated. Not everybody wants to have a really active lifestyle, but there's things
Mm.
you can do at home to keep your brain active and those pathways stimulated.
Would you like to share more about where you can learn about yourself and what you do and your organization and everything?
Yeah, so you can, of course, go online to hearinglife.com and learn all about us, and we do complimentary hearing assessments. You can also learn about the Campaign for Better Hearing, which is just a nationwide program we do that we donate money for every test that we perform towards people to get devices that can't afford it and that are in need. So that's something else you can look into. Or you can just stop in at our clinic in Greenwood Village or give us a call. We're always happy to answer questions.
Okay, great. Thank you so much for your time. This was really beneficial. Feel like I learned a lot, and this will help our audience, so I appreciate it.
Yes, thank you so much for having me.
Yeah, of course. Have a good rest of your night.
You too. Bye.
Bye.